Good morning, my name is Destine Eljo, a level 1 BSN student. So today I'm going to perform the return demonstration on the intravenous therapy. So what is intravenous therapy? So it is a treatment that infuses the intravenous solution, medication, blood or blood products directly into the vein. So we have 5 purpose on this. First, we have to supply the fluid when the clients are not able to take an adequate amount of the fluids directly by the mouth. This is also to provide for the salts and other electrolytes needed to maintain the electrolytes in balance. This is also to provide glucose or the dextrose, which is the main fuel of metabolism. It also provides for the water-soluble vitamins and medication. And lastly, this is to administer for the blood or blood products. So now we are on the common complications on the IV therapy. So first we have phlebitis, which is the inflammation of the veins inner lining, which is the tunica intima. We also have the extravasation that occurs in the vesicant solution or the medication, which is administered and inadvertently leaks into the surrounding tissues. So this will cause damage into the surrounding tissues. And we also have hemorrhage, which is the bleeding from the puncture site, and also the local infection of IV site. It is indicate because of the purulent drainage from the site, and usually 2 to 3 days after the IV site is started. So now we are going to the skills. First thing that we're going to do is we're going to verify for the doctor's order or the prescription of the doctor. We're going to check for the IV solution and also the medication additives with the order, and also we're going to compute and make an IV data. So this is to avoid for the medication error, and also the physician's order is the most reliable source, and only the legal records of the drugs or the IVF client is to be received. So we're going to check. Okay. After that we have done, we are going to serve for the 12 rites when we are preparing and administering the IV fluid. So this is a safety check to ensure that the right medication is given, and if it is not identical, we're going to recheck it with the prescriber's written order in the chart, and if it is still discrepancy, we're going to check it with the nurse in charge or the pharmacist. After that, we're going to prepare for the necessary materials for our procedure. So, as a nurse, I'm going to prepare the IV tray with the IV solution. We also have administration set, the kidney basin, and also have the IV pole. So, organization and planning promotes it will results in the economy of time and effort, and also it will minimize for the confusion. After that, we're going to check for the sterility and also the integrity of the solution. So you will need to verify for the integrity of the solution, and we're going to check for the expiration date. So the outdated medications are not safe to administer. So it's okay. After that we have done, we are going to after that we have done it, we're going to place the IV tub without covering the IV fluid and bottle with the patient's name. We also have the date, the time, the IV fluid flow rate. We also have the due time, and also the name, and also the signature of the patient in charge. So we're going to note for the expiry date of the IV bulbs. It is reported for in the year and also the month. So this is valid for the entire month. So after that we have done, we're going to perform hand hygiene. This is to prevent the spread of microorganisms. And then after that we have done performing the hand hygiene, we are going to identify the client. So in identifying the client, this step will ensure that the right patient and the patient will comply with the agency standard for the patient's identification. So good morning, ma'am. So may I know your name, ma'am, please? Okay, Mrs. Lokias, may I check your identification band? Thank you, Mrs. Lokias. So after that we have done, we're going to explain the procedure to the patient, and also if the patient is not to give his or her name, we're going to ask for the significant others. So the exchanging of the information allays fears and also promotes cooperation. So this will also builds the trust with the patient and allows the patient to ask questions to the nurse in charge. So, ma'am, today I am going to I'm going to put a intravenous fluid solution administration. So this is an administration for your medication, ma'am. Is it okay, ma'am? Thank you, ma'am. So after that I have done it, the thing that I'm going to do is we're going to open the IVF bottle without touching for the rubber port to maintain the sterility. So this will maintain the sterility of the rubber port. Now after that I have done opening it. The next thing that I'm going to do is I'm going to open for the administration set aseptically, and then we're going to open it, and then I'm going to close for the roller clamp. After that I have done close the roller clamp, I'm going to open the cover, and we're going to after that I'm going to spike the infusate container aseptically. Now that I have done spiking it, we're now going to hang it into the IV pool. So the close proximity of the roller clamp, it will the close proximity, this is to drip the chamber, and it also allows for the accurate regulation of the flow rate, and also the clamp, it will prevent from the spillage of the IV fluids in the nurse. We also have in the bed, the patient, and also in the bed and also in the floor. So after that, the thing that we're going to do is we're going to squeeze the chamber and allow it to full at least halfway. So the drip of the chamber will partially filled with the solution, and this is to prevent for the air that comes into the tubing. Now that I have done squeezing it, we're going to remove the cup. I'm going to remove the cup on the end of the tubing, and then we're going to open the roller clamp. After open the roller clamp, we're going to allow the air bubbles we're going to allow it to flow until the air bubbles will be disappeared, and then we're going to close after it the roller clamp and we're going to recap the tubing to maintain for the sterility. So I'm going to open end. We're going to open the roller clamp and allow it to. And then I'm going to close and cover it. So in this step, so the tubing is primed to prevent for the introduction of the air into the client, and also the air bubbles, which is smaller than 0.5, usually cannot cause any problems for the peripheral lines. So after that we have done, we are now to the thing that we're going to do is we're going to place the correct filled up we're going to place the filled up label of the IV fluid bottle with the patient's name, time, date. We also have the IVF flow rate, due time, and also the nurse name and the signature. So in many agencies, the medication and also the are added, and also labels are applied on the IV container in the pharmacy. So if they are not, we're going to apply the label upside down. This is so that we can read it better when it is hanging up. So we're going to apply. After that, we have done putting the label on the IV solution. We are now going to perform hand hygiene. So this is to prevent the spread of the microorganisms. And after that, we're going to document for the date, the time, the type of the IV fluids, and also the effects of your signature in the parental fluid sheets. So timely and accurate documentation will promote for the patient's safety. So now we're on the changing of the intravenous solution. So first thing that we're going to do is to verify for the doctor's prescription in the doctor's order sheet. So we have to counter check for the IV label, the IV tag. We also have the infusate sequence, the type, amount, and also the additives, and we also have the duration of the infusion, which is the rate per hour. So this is to avoid for the medication error, and the physician's order is the most reliable source, and only the legal records of the drugs or the IV fluids a client is to be received. So after that, what we're going to do is to identify the patient. In identifying the patient, this will ensures that you have the correct patient and complies with the standard or the agency standard for the patient's identification. So good morning, ma'am. May I know your name, please? Thank you, Mrs. Lokia. So may I check your bond? Thank you, ma'am. So after that, we're going to explain the procedure to the patient or to the significant others. So exchanging information allays the fears and also promotes further cooperation. And this will build trust with the patient and allows time for the patient to ask questions. Ma'am, so now I'm going to change your intravenous solution. So since it is consumed, the doctor order another. So is it okay, ma'am? Thank you, ma'am. So after that, the thing that we're going to do is to perform hand hygiene. This is to prevent the spread of microorganisms. After that I have done hand hygiene, we're going to remove carefully the protective cover of the new solution and expose the bag or the bottle of the entry site. So this we're going to prevent further contamination that allows the microorganisms to enter for the infusion equipment or else on the bloodstream. So we're going to after that we have done, we're going to close for the clamp on the tubing. So this is to prevent from the spillage of the IV fluids in the nurse, the patient, in the bed, and also in the floor. After that I have done it, we're going to lift the container from the IV pole, and then we're going to invert it and remove it quickly. So after that I have removed it. So this is to prevent for the spilling of the isolation, and also this ensures for the IV tubing spike that will remain sterile during the removal, and also avoid for the contaminating of the IV tube. So after that, what I'm going to do is we're going to place the new container on the flat surface, and then we're going to hold it sterilely, and we're going to insert the spike. Now that I have done insert the spike, we're going to hang it into the IV pole. Now that I have done it, so for using for the gently back and forth of the twisting, it will firmly insert the spike into the new IV's back. So this ensures the principle of the asepsis that will follow. So after that, we are now going to reopen the clamp, and then we're going to reopen it, and we're going to check for the deep chamber of the administration set on the tubing, and regulate for the flow rate according to the prescribed infusion rate. But before that, we're going to open first, and we're going to open, and we're going to close. So we're going to inspect for the presence of the air bubbles. If there is any air bubbles, we're going to top it. We're going to tap for the tubing, and then or else we're going to use a sterile syringe for the aspirating. So if there is presence of bubbles, we're going to top it. So if there's not, we're not going to top it. So So after that, I've done tapping it. So the presence of the bubbles can cause for the problems in the line and also embolism. And if the bubbles or the air bubbles is smaller than 0.5, it is not usually cannot give a problems to the peripheral lines. So after that, we are going to after that we have done, we're going to discard for the waste materials according to the according to the healthcare waste management, the DOH or the DENR, and perform for the hand hygiene. This is to prevent the spread of microorganisms as well as the biohazards. And then after that, we are going to document for the date and also the time, the type of the IV fluid, and also the affix of your signature, and in the parenteral fluid sheet. So the timely and accurate of the medication of the documentation, it will promotes for the patient's safety. So now we are on the medication incorporation of the drugs into the IVF bottle or the bottle. So first thing that we're going to do is we're going to verify for the written medication card, and then for the doctor's prescription. So this is to avoid for the medication error, and the physician's order is the most reliable source, and only the legal records of the drug or the IVF client is to be received. After that, I'm going to prepare for the necessary materials needed for the procedure. So we have the medicine tray, we also have the syringes needed, we also have the alcohol swab, right drug to be incorporated either in the vial or the ampule. So organization and planning promotes or planning results in the economy of time and effort, and also minimize for the confusion. After that, we are going to observe for the 12 rites when we are preparing and also administering for the medication. So this is a safety check to ensure that the right medication is given. If it is not identical, we're going to recheck it with the prescriber's written order. And if it is still discrepancy, we're going to check it with the nurse in charge or the pharmacist. After that, we are going to perform hand hygiene. So this prevents the spread of microorganisms, and we're going to identify for the patient. So these steps ensure that you have the correct patient and complies with the agency standard for the patient's identification. Now that we have identified the patient, we are now to verify for the skin test of the IV incorporation. So it will ensure that the medication that you that the patient is not allergic with the medication that you have to give. And after that, what we're going to do is to disinfect that injection port of the vial or the ampule before breaking, and then we're going to aspirate the right dose aseptically. So the alcohol and the alcohols and the friction sanitizes, and allowing the alcohol to dry renders the antiseptic properties that will become effective, and also the cleaning access ports before each syringe is attached and after each syringe is detached. It will reduce the risk of the infection. So after that, we are going to close the roller clamp, and we're going to pull the set of it, and we are going to disinfect it by using the alcohol swab So this will incorporate the prepared drug, and then we're going to respike the IV set into the bottle, then place it into the IV tub. So alcohol and also the friction sanitize, and allowing the alcohol will dry. To dry, it will render the antiseptic properties effective, and also the cleaning of the access ports before the syringe is attached, and also after the syringe is attached will reduce the risk of infection. So after that, we are going to swirl the bottle. So in swirling the bottle, this is to mix the drug with the IV fluid, and we're going to regulate it. We're going to regulate it so that the flow rate will be right. So this will ensure that the medicine is mixed inside the bottle. And after that, we are going to observe for 5 minutes to 10 minutes for the drug reaction or the drug interaction while we are reassuring the patient. So this is to watch for any untoward signs and also symptoms after the medication administration. So after that we have done it, we're going to discard for the sharp materials, and then we're going other waste materials according to the healthcare waste management, the DOH or the DENR, and perform for the hand hygiene. So this is to prevent the spread of the microorganisms and also the biohazards. After that, we are going to document for we're going to document for the date, the time, the type of the IV fluid medication incorporated, and also the the nurse signature in the parenteral fluid sheets. So timely and accurate documentation will promote for the patient's safety. So now we are on the medication incorporation and also in the volumetric chamber. So in this, we're going to first also verify for the written medication card against the doctor's prescription. This is to avoid for the medication error, and the physician's order is the most reliable source, and only the legal records of the drugs or the IV fluids applying is to be received. So after that we have done it, we're going to observe for the 12 rights when we are preparing and administering for the medication. So this is the safety check to ensure that the right medication is given. If it is not identical, we're going to check it with the prescriber's written order on the charts. And also if it is still discrepancy, we're going to check it with the nurse in charge or the pharmacist. After that we have done it, we're going to perform hand hygiene. This is to prevent the spread of microkinesis. After we have performed hand hygiene, we're going to identify for the patient. So these steps ensure that the patient will have the correct, the nurse will have the correct patient, and it will comply for the agency standard for the patient's identification. So after that, we are going to explain the procedure, the medication, and also the actions. And this will reassure for the patient and significant others. So the exchanging of information, it will allay the fears and also promotes cooperation. And it also, the site or the IV will be free from the swelling, the redness, um, pain prior to administering for the medication. So, next thing that we're going to do is to verify for the skin test of the, we're going to verify for the skin test of the drug of the IV in preparation. So this ensures that the medication that you have given to the patient is not allergic with it. So after that, we are going to disinfect for the injection port of the vial or the vial or the ampule before we breaking. Then we're going to aspirate the right dose aseptically. So the alcohol and also the frictions sanitizes and allowing the alcohol to dry. It will render allowing the alcohol to dry will render the antiseptic properties effective, and also the cleaning access ports before each syringe is attached and after each syringe is attached will reduce the risk of the infection. After that, what we're going to do is we're going to fill the volume control chamber with the desired amount of the IV solution by we're going to open the clamp between the IV bottle and also the volume control chamber. So when it is in the correct solution, we're going to close the clamp. So the sum of the medicine it will require for the specific amount of the diluent. So after that, the thing that we're going to do is we're going to check, cleanse for the injection of the port with an alcohol swab on the volume control chamber, and then we're going to inject the medication in the solution. We're going to inject it into the solution in the chamber. So the alcohol and also the frictions sanitizes and allowing the alcohol to dry renders the antiseptic properties effective. And also the cleaning of the access port before each syringe is attached and after a syringe is detached will prevent or reduce the risk of infection. After that, what we're going to do is we're going to gently rotate for the chamber. This is to mix the medication and to ensure it will ensure for the mixture of the medication. After that, we're going to hang the volumetric chamber 3 feet from the patient or 3 feet above the patient. So the height is being needed to enable the gravity to overcome for the venous pressure, and it facilitates the solution. It will facilitate the flow of the solution in the vein. So after that, the thing that we're going to do is we're going to open the roller clamp. We're going to open the roller clamp below secondary setup, and then we're going to regulate at prescribed delivery rate. So this is to have the fluid flow, and also when we are using the gravity, the count, we're going to count the drops per minute in the chamber or the drug chamber. And then what we're going to do is we're going to evaluate for the patient's response to the medication within approximately or 5 to 10 minutes. And then so this is to watch if there is any untoward signs and also symptoms after the medication administration. The next thing that we're going to do is we're going to check for the volume control chamber with the date, the time, the medication, and also the doses that added, and also your the initials according to the agency policy. So this is to avoid for administration of the accidentally repeating the administration of the drug, and also if the drug was omitted or if it is refused, we're going to record for the we're going to record it, and then we're going to notify it to the primary healthcare provider. So after that, we are going to flush the tubing with a 10 cc NSS when the medication has finished infusing. And then we're going to detach the secondary setup and keep the set sterile. So this is the avoid for the confusion, especially if there are no numerous medicine drips. So after that, what we're going to do is we're going to discard the sharp and other waste materials according to the healthcare waste management or the DOH, the DENR, and perform the hand hygiene. This is to prevent the spread of microorganisms and also biohazards. After that, we are going to start the administration of the medication after it has been infused. So this can be done on the medication administration record. So the timely and accurate documentation will promote for the patient's safety. So now we are on the discontinuing of the IV infusion. So first thing that we're going to do is to verify for the written doctor's order to discontinue the IV, including the IV medications. So this is to avoid for the medication error, and the physician's order is the most reliable source, and only the legal records of the drugs or the IV fluids a client is to be received. After that we have done, we're going to prepare for the necessary materials. So we have an IV tray, we also have a gloves, clean gloves, a kidney basin, alcohol swab, and also the dry alcohol, and we have the plaster. So organization and planning results in the economy of time and also the effort, and it will minimize for the confusion. After that, we are going to identify the patient, and we're going to explain the procedure to the patient on discontinuing for the IV infusion. So these steps ensure that you have the correct patient and complies with the agency standard for the patient's identification. So good morning, ma'am. May I know your name, please? Thank you, Mrs. Locas. So today I'm going to discontinue your IV medication as well as the IV infusion as ordered by your doctor. Is there any question, ma'am? Thank you, ma'am. So after that we have done it, we're going to perform hand hygiene. After that we have performed hand hygiene, we're going to don disposable gloves. So this is to protect the nurse hands. After that we have done the gloves, we're going to now close the roller clamp. We're going to close the roller clamp on the IV administration set. So, closing the clamp, it will prevent for the spillage of the IV fluids on the nurse, the patient, the bed, and also on the floor. After that, we're going to moisten the tape around. We're going to moisten the tape around the catheter with a cotton ball with an alcohol, and then we're going to remove for the plaster. So the movement of the catheter, it will injure the vein of the patient and it will cause further discomfort. And moistening will prevent for the pulling of the skin that will cause discomfort of the patient. After that, we have done it. We're going to cover the cannula with a dry cotton ball without applying any pressure, and then we're going to remove the catheter immediately, and then we're going to wait for we're going to do not put any pressure for over in the venipuncture for over 2 to 3 minutes. So this procedure will in the pulling of the out in the line with the vein, it will avoid for the injury of the vein, and also it will avoid from the injury in the vein. So you should the nurse should not press down the sterile gauze while the nurse is removing for the catheter. This is to prevent stop the bleeding, and also it will prevent for the any problems. So we're going to cover it with a So after that we have done it, we're going to examine that catheter. We're going to examine the catheter that we have removed from the client. So if there is if a piece of the tubing will remains in the client's vein, it could move the centrally toward the client's heart, or either in the lungs. So after that, what we're going to do is we're going to check for the catheter to make sure that it is intact, and also we're going to report the broken catheter in the nurse that is in charge immediately. And then after that, we're going to hold for the client's arm above the heart level. If there is any bleeding that is persist. So the raising of the raising of the limbs will decrease the blood flow on the area, and also we're going to place the dressing over the venipuncture site. So the dressing will continues the pressure, and also it will cover for the open area of the skin that will prevent for the infection. So after that, we're going to teach our client to inform the nurse if any side begins to bleed at any time of the client's notes by the abnormalities. So we're going to assess for the signs and also the signs of the infection or the phlebitis. So after that, we are going to discard the waste materials, and then we're going to discard for the waste materials, including the IV cannula according to the health care waste management, the DOH or the DNR, and we're going to remove our gloves. So we're going to remove our gloves, and then we're going to perform hand hygiene. So this is to prevent the spread of microorganisms and also the biohazards. So after that, what we're going to do is we're going to document for the patient's time of discontinue, the status of the insertion site, and also the integrity of the IV catheter affects, and your signature in the parenteral fluid sheet. So the timely and also the accurate documentation, it will promotes for the patient safety. So for the attitudes, we're going to observe for the courtesy and also the tactile fullness. We also appear we're going to also appear clean and well groomed, and we're going to accept the any corrections and criticisms, and also clean, organized, and systematic in the entire procedure. And also we're going to maintain for the body mechanics, all throughout the procedure. And then lastly, we're going to show calmness and also the confidence.